So, good evening and welcome back to the TRT and Hormone Optimization YouTube channel. And as a guest today, we have someone from the UK. Welcome, and maybe start by introducing yourself.
Hi, thank you, Stephen. Yes, I'm Dr Angela Servis. I'm a GP, and we've just done our opening for a new testosterone replacement and men's health clinic today. So it's a very exciting day. Yeah.
Awesome. And how did you become into this world of TRT and hormone optimization?
Yeah, absolutely. So I've been in the army for the last 17 years, and I did my medical training in there. I then also went on to become a GP, and clearly being in the military, a large proportion of my patients were men. And there was one particular patient who, bless him, has been really generous and let me share his story. But essentially, he was at one of the first regiments I ever worked with, and I just remembered him being like really full of life, very energetic. He had a beautiful family life. He had a wonderful wife. He played rugby and was very much into his sports. And I saw him come up on my patient list. And I remember thinking, oh, this will be fun. You know, haven't seen him for a while. I wonder how he's getting along. And he came in and he was a shadow of himself. And it was heartbreaking. It was really, really sad. And I'd sort of looked back through his notes, and he'd been on a few different antidepressants, and he came in and he sort of had the central obesity. He was just looking tired, miserable. He was struggling at work. He was saying, you know, his marriage was in trouble, and he'd always had an amazing output at work and everything, loads of energy. And I kind of thought, this just doesn't look like straightforward depression. He hadn't had any bloods done or anything. And on a bit of a whim, for that, that time in my medical career, I did a testosterone level and found it to be in his boots. I then had to do quite a lot of research and looking around, because it's not very well taught in the UK at med school. And not even when you're doing your general practice training is it really touched on. So I sort of started looking into the British Society for Sexual Medicine and found some really useful guidance there. And that really prompted the beginning of my real education into men's health. And, it was phenomenal. And actually within 6 months, his life had really turned around and he'd gone back to being him. Luckily he hadn't, he maintained his career and he did really well there, and family life picked up and everything. And he sort of came back to being the larger than life, incredibly gregarious man that he was previously. So that's really where the passion started. And yeah, that's sort of taken me to where I am now.
Yeah. It's the same thing here in Belgium. During med school, you aren't taught anything about TRT or whatever. I've never heard the term before even. Just when I got problems myself with low testosterone and all the symptoms that go along with it, I started looking into it, and I couldn't even find a urologist here or an endocrinologist that knew anything about it. So it's exactly the same thing here. So me, myself, I had to start looking around on the internet, especially I came into contact with doctors in the United States. But where did you get your knowledge about this topic?
So, I think my starting point was the British Society for Sexual Medicine. Professor Jeff Hackett was incredibly generous with his time, and sort of walking me through, the stance that the BSSM have. And that was incredibly useful. It was a really good sort of starting point. And then, sort of started looking overseas to see what other people were doing. In the UK, we're very prescriptive about the services that we can offer and what is on license or off license. And the starting points here are usually Libido or Undecanate or the gels as well. And obviously, they've got their drawbacks and they're quite limiting, but that's pretty much all you're going to get on the NHS. And the other thing I think is it seems to be very common worldwide that actually there just doesn't seem to be an accepted treatment threshold. And there's a real postcode lottery here, geographic lottery about what point a doctor's going to treat you or not treat you. And they're just, laboratory normal ranges that they put on their forms are really unhelpful and completely vary from place to place. And I think we are, as doctors, are quite disempowered, certainly working within our healthcare system, to make decisions based on clinical findings and looking at a man and how he's feeling and how he's being affected by his hormone levels. When you've got a set of normal ranges, and if they're not in red, you can't treat. If they're not being highlighted as being wrong, then I think a lot of doctors feel really disempowered. And I think that's one of the real significant issues that's actually stopping us being able to use our medical skills and make those decisions based on how your patient is feeling right in front of you. So, yeah. And then more recently,
that is the case. So how do you go around that?
Yeah, so it's by working in private practice, essentially. So, making sure that you're still working off evidence-based practice. I recently traveled to the International Society of Sexual Medicine over in Miami, and that was fantastic. It was shortly after a phenomenal conference led by Ali Gilbert at the Silverback Summit, which was just further north of Miami, which is absolutely amazing. And Jordan Grant was speaking there as well, and Gil was there. So some phenomenal speakers, and actually really reaching out to the international community to find out what's happening elsewhere. And, not having to sit around and wait for UK guidance and guidelines to catch up with what's being practiced very safely and effectively elsewhere in the UK, but also ensuring that your practice, like I said, is safe and, the best options for your patients. Making sure you're sort of prioritizing their healthcare. But yeah.
What are basically the big differences between treatments in the United States and in the UK and Europe, maybe?
Yeah, I think that's a really interesting question. I think the healthcare model in the UK can be quite limiting. So, I mean, there are various different factors here that really change the way a man, even going right back to the basics of how will a man seek help, medical help. And, having probably had 90% of my patients be male within the primary healthcare setting over my military career, the amount of times that the male patients will come in and say, my partner said I should come in because of X, Y, and Z. And that's not just about men's health issues or erectile dysfunction. That's about anything. And I think part of that is because the way we seek health in Britain isn't particularly facilitative for men. So, for example, women will have loads of touch points during their medical careers, so to speak, in that they'll have period consultations about contraception, about HPV vaccines, about smears and breastfeeding pre and postnatal, and then they get quite a lot of hands-on treatment with regards to their own hormone replacement therapy. Whereas with men, they don't have all of that. So they're not particularly good at coming forward and reaching out to get those health checks done. And particularly now, while our healthcare system is under so much stress and so much strain, coming into the GP who's got a 10-minute consultation to see you to say, a lot of the time these guys have real difficulties verbalizing what their symptoms are. And actually sort of sitting there and, you could say to them, do you have brain fog? Are you having your morning erections? Are you, how's your energy? All of those things and everything. And they might be able to answer in the affirmative to some of those things, but they're not necessarily going to be able to succinctly say it in a 10-minute consultation and give the GP the opportunity to sort of explore those things. And even if they did, often the first route, which I hear so much, is that they get offered antidepressants, which obviously we all know worsens a lot of the symptoms that they're going to be having, certainly from an ED point of view as well. Whereas I think from what I've heard from some of my American colleagues is that actually the health service over there is looked on as just that, as a service. You will sort of outreach. Obviously there's financial ramifications for it, but you'll be, I think, from what I've heard, men are a little bit more empowered to go out and say, actually, this isn't right. And they feel a bit happier about communicating these things. Even when I'm seeing private patients now, I'll regularly get chaps sort of sitting there and they've got confirmed very low testosterone. And I've said, I can refer you back into the NHS if there's cost implications that are too challenging for you. And actually often they'll sort of sit and say, oh, well, I don't know. And they'll and ah about it. And a lot of the time it will come down to them thinking, you know, this is me taking my money, or maybe taking money for the family away from the family and just spending it on me. But if you turn it around and say, if your wife were in the same position having similar symptoms, how would you advise her? And almost always they're like, oh yeah, absolutely. Exactly. So I think, you know, there is a real health inequality. And I think that that's something that needs to be explored. It needs to be explored from every direction, in sort of empowering men to make those decisions, to get into the doctors, to consider their health something that they can control and that they can investigate and that they have a right to do. But also taking it back to the other direction, actually giving med students and doctors direct pathways into places where they can get information and help, rather than, you know, sitting feeling quite disempowered as a doctor, because it's horrible, because no doctor wants to go into work and not be able to serve their patient and, you know, help get them better. But at the same time, if they think, I don't know how to manage this, I'll refer them to endocrinology, and that's another year's worth of this man sitting with a horrendous testosterone and all the damages that goes alongside that. You know, the sort of the bone health issues, the cardiovascular health issues, etc., and, you know, diabetes risks and things. So yeah, I think it's big. It's a big topic. And it's sort of hard to know where to start, but yeah, I suppose education is really key across the board.
Yeah. And the treatment itself, is there a lot of comparison between United States and Europe, UK?
Yeah, so if you look at UK guidance, looking at our British National Formulary, so that's the sort of the compendium of where we keep all our medications and everything, they're still quite old school with their dosing. You know, obviously the undecanate is, you're looking at 12-week, you know, injections every 12 weeks done in your GP surgery. And, you know, that and also some of the testosterone gels are the most commonly accepted and provided. But even when you are looking at Sustanon, etc., they're looking at the advices to give it every 3 weeks in a larger dose and things like that. Whereas actually, you know, what seems to be happening certainly across the pond, yeah, quite, I can see you shaking your head there. And I can, you know, I think certainly chaps I've spoken to that have had that experience have just had really, really difficult time on it. Sort of the peaks and troughs and the highs and lows, just not much fun at all. And I think it's, you know, it can be, it is a massive emotional roller coaster, you know, but when you don't need to chemically cause that and you can do it in a much, you know, physiologically more settling way, because actually a lot of the time, by the time people do come out and reach out for help, they just want to get on the straight and narrow and don't need the peaks and troughs and to be messed around with treatment practices that aren't necessarily going to take them to the optimal place straight away. So, yeah. Yeah.
So you just opened a new clinic, if I understand well?
Yes, that's right. So I've literally just been on my way out of the military after a really wonderful 17 years. It's been absolutely fantastic. And I'm just opened Eden Clinic for Men here in sunny southwest England in Plymouth. And yeah, so we're, you know, just getting set out there in private practice, which I'm really excited about. So, yeah.
What kind of treatments can you offer? Is it just for men?
So I've got an aesthetic side to my business as well. So I've got Eden Clinic for aesthetics and then Eden Clinic for men. And I focus from a hormone replacement point of view solely for men, and erectile dysfunction as well. A lot of it is actually education, partly lifestyle issues, and also I offer some weight management treatments as well, including Ozempic. I also sort of tie in with regards to referring into Plymouth Performance Gym as well for some weight management support for some of my patients, because as you're aware, you know, weight management issues and low testosterone go hand in hand. And actually, I keep telling a lot of my guys that, you know, the testosterone isn't going to do all the work. You know, it's a lifestyle change, and it's, you know, it's learning to prioritize your health, and, you know, the physical activity and everything really sort of coincides in supporting all of that. The testosterone does part of the work.
So you are able to prescribe peptides as well?
No, that's not something I'm doing at the moment. It's something that, again, this is something that's a bit more of a struggle in the UK. And this is one of the things I was chatting to a couple of the doctors about when I went over to on the ISSM and at Ali Gilbert's Silverback Summit as well, and that definitely came up. And that's another thing actually. So compounding pharmacies, I don't know whether or not they have them in Europe, but that's not really something that the UK sort of gets involved with either. So there are certainly lots of other opportunities for work like that in the UK, in the US. Sorry.
Mm-hmm.
Is that something that's is that something that's offered in Europe?
Okay, so
peptides?
Yeah, here in Europe, no, peptides are not just readily available, but we have compounding pharmacies. So we can have pharmacies compound, for example, testosterone cream, but I'm sure you can have that as well in the UK. Yeah,
so there are some pharmacies that will do creams now. That's relatively new to my knowledge anyway. The availability of creams in the UK, it was specifically mostly just gels, but has become more available in the UK now. But not so much the peptides. So it's interesting to know that that's the same. And I wonder how soon behind we'll be able to catch up with America.
Yeah, let's hope Europe and the UK catch up really quickly.
Yeah, absolutely.
One last thing, if people would like to contact you, how can they do that?
Oh yeah, fantastic. So you can find me on EdenClinicForMen.co.uk on my website, or there's Eden Clinic Plymouth on Instagram or Facebook as well.
Awesome. I'll put the links to it in the description of this video.
Oh, I really appreciate that. Thank you.
So thank you so much for sharing your story. It was very interesting to me. So I hope the viewers will like that too. And talk to you next time. Thank you so much.
I look forward to it. Thank you.